Well, good evening. Welcome. Welcome again into 1017 FM and 710 KEEL. Welcome again into another edition of Strategies for Living. I'm marriage and family therapist David McMillan. There she is, smiling like a chessy cat down at the other end of the broadcast table, PLPC Carla McCormick. How you doing,
Dave.
Carla?
I'm good. Boy, doesn't it feel like Monday today? Has it been Monday all day
All
for you?
day long, and I'm just so confused, and I'm hoping our guest, our life strategist, is going to help me and maybe clear my sinuses at the same time.
Oh, I can tell you that he's one of my favorite people.
Oh, Monty, and I got a story. He's a great guy. He's a fantastic physician. We're going to talk about sinuses today. And, yeah. Our life strategist is Dr. Bill Parker. We'll bring him on in a minute. But how are your sinuses, Ace of the Airways? Ruben, right?
They're all right. They're all right today, but
Yeah.
that could change at any minute.
We do live in Louisiana, so yes, that could change
Yes.
at any minute. All right, so welcome, folks. Welcome into Strategies for Living. We've got a lot. Your sinuses should not define you, and Dr. William Parker will tell you more about that. Thank you for tuning in to Strategies for Living. We're presented by CADA, the Council on Alcoholism and Drug Abuse of Northwest Louisiana, helping individuals and families for 60 years now. We're also brought to you by Milestones Counseling Center, by Jerry Anderson State Farm Insurance, by Learning RX, by Highland Place Rehab and Nursing Center, by Resilient House, and by Jacob's Well Inspirational Books and Gifts. Coming back on Strategies to meet Dr. William Parker. Stay with us. We've all got a lot to learn.
Doctor, my eyes have seen the years and the slow parade of fears without crying.
If we're talking addiction, welcome back. Welcome back into 1017 FM and 710 KEEL. Welcome back into Strategies for Living. Let's welcome to the program now Dr. Bill Parker, our life strategist this evening, who started private practice at the Highland Clinic. He remains there today. He's clinical instructor at LSU ENT, head and neck surgery department. Fortunate enough in 1983 to be inducted into the American College of Surgeons, the most prestigious surgical academy in the country. 1984, selected to be a fellow in the American College of Facial Plastics and Reconstruction Surgery. Let's welcome Dr. Bill Parker as our life strategist here on Strategies for Living. Dr. Bill, welcome.
Thank you, David.
It's been a
while.
It has been a while.
Thank you, Carla.
Oh, I love having you here.
Man, it is our honor, and again, your practice is where it started, over at the Highland Clinic, and
Well, we made a move from downtown, but
yeah, there you go,
it's still the same corporation.
There you go. So we're going to talk a lot about what you do this evening, and I don't know, is there anything worse than chronic, your nose is just stopped up, and it's chronic, and you can't do anything about it. Anything worse than that?
The biggest complaint that most people have with sinus issues is congestion.
Yeah.
Number one complaint, and that's we ask, are you stopped up? Do you have drainage from your nose down the back of your throat? Do you cough? Do you have a sore throat?
Right.
And we get those answers in the affirmative, and then you start asking the questions that have to do with duration. How long has this been a problem?
Right.
When you're good, do you still have symptoms? And have you kind of reset your normal so that you're still dealing with a lot of symptoms?
Right.
But you just assume you're good because you're not sick as hell.
What's the least that we need to know in terms of you're our life strategist? I don't know that there's, first of all, I don't know that there's many people in town, I'm gonna brag on you a little bit, that know more about ear, nose, and throat than this guy. But I got to tell a story.
Uh-oh.
I got to tell a story, and he doesn't know.
Is that because he told the story on you?
No, well, he's not going to tell that on the air, but
be nice.
I'll be nice. I don't know if you remember this. Years ago, you had to diagnose a patient. You had seen her I think you'd been involved in the emergency treatment of this patient. And unfortunately, you had to break some news. You had to break some bad news to the family. There just wasn't any. But the compassion that this man, and I remember you took me out of the room. He took me out of the room, and he told me, he said, I got to go, and I got to tell him what I got to tell him.
I do remember that.
Yeah, and big old tear. Now he didn't do that, and he didn't do that when we went into the room. It was very well done, but with a lot of compassion. But outside of the room with me, because you and I
remember you. I remember you being there.
I was there, and
I was kind of comforted that you were there.
big old tear, and I said to myself, and I knew what kind of surgeon and doctor this man is. He's legend. But I don't, you don't know how, you don't care. People don't care how much you know until they know how much you care. Dr. Bill Parker cares. And I had to share that story. I'm sorry if I crossed over a line, but I just got to tell that story. That's who this guy is.
I know.
Yeah.
He's the same guy that carries the little kid into the operating room because they're scared and they're about to get their tonsils taken out or tubes in their ear. He's that guy. He's that guy who'll let the little 4-year-old put bows in his no hair.
I love it.
Bows in my no hair. We had to put double stick tape on the bows so that it would stick on my bald spot.
I mean, so not only is he a world-class surgeon, he's a good guy.
Yeah, exactly.
I got a fun job, yo.
Did you know early on, you've been doing this a while, I went into practice in 1981. Did you know you were headed for ear, nose, and throat? You were going to do this specialty and this kind of surgery? And did you know before medical school, during medical school? When did you know?
No, I think what I wanted was to be a hand surgeon until I really studied the anatomy of the head and neck.
Right.
and face and how things work, and I became enamored with that area of the human body. And having been an allergy sufferer as a child, it seemed fitting to try to become an ear, nose, and throat specialist. And during my residency and my subsequent fellowship in plastics, the division of that area expanded so much that we as ear, nose, and throat specialists became and took ownership of a lot of the facial plastic and reconstructive surgery, and it just dovetailed into what we already knew.
Right.
So by the time I was halfway through medical school, I was convinced that that's what I wanted to do.
This is where you were headed.
Yeah.
Well, I got to tell you, sir, this is where you belong. And
is
Shreveport,
where-
Bossier City is blessed to have
It
you.
is where I belong, and I'm blessed to be in Shreveport and Bossier City.
What do we need to know to keep ourselves healthy? Let's look at all the areas that you work with: the nose, the throat, the ears. You know, what do we need to know? What's the least
It's
we
the
need to know?
same thing that everybody will always say, and it's wash your hands. if you can wash your hands several times during the day and wash them well,
Yep.
then you'll be less likely to bring germs from your hands to your face or your nose, and thereby cut down on the spread of contagious viruses and bacteria and things like that. And so if there's one thing to do, it would be to wash your hands. Now, if you're an allergy patient,
Right.
and you know you're allergic to dogs and you sleep with a dog, for crying out loud, you're not going to be well. You know?
Then you need to go see Carla.
So you need to avoid the things that you're allergic to, and if it's dust and mold, then look at the blades on the ceiling fan in your bedroom.
Right.
If you got dust on them, then you're going to have stopped up nose.
So what I'm hearing you say is common sense. Is there a right way to wash our hands? I mean, do most people wash our hands the right way?
I think there's a certain number of seconds or 30
Isn't it
seconds.
like 30 seconds,
Yeah, I think
and
it
make
is.
sure you
There's a
wash
magic
the backs,
number.
the backs of your hands.
There's
too.
a magic number, and it's just not that hard.
Right. Right.
And it's the patient that gets sick and stays sick, that with nose and sinus and coughing and chest and whatnot, those are the people who usually end up in my office.
Right.
People who get sick and don't take care of themselves.
So, Dr. Parker, it's summertime. So how come we always hear summertime colds are worse? And how do I know when it's a cold and just to go see my doctor, my primary care physician, or when it's time to come to see you?
I think, Carla, the easiest answer is a cold generally is a burning nose, burning roof of the mouth, kind of a sore throat, followed by lots of mucus in your nose and down the back of your throat, and you feel bad from the get-go. Why a summer cold is worse than a different cold, I'm not sure I know the answer.
Is it, or is that just a wives' tale?
I just think it's a wives' tale.
So
But-
how do I know when to see you? How do I know? I guess when it's a sinus infection.
Well, if it doesn't go away after 2 weeks, it's a sinus infection. And if you see your regular doctor and you get treated with decongestants and antibiotics, and you're still sick, and you go back to your doctor and you get treated again, sooner or later, he ought to throw in the towel and send that patient to me or one of the other ear, nose, and throat specialists in town.
So I come into you. I've got a sinus infection. What's the procedure? What's going to happen?
Part of my job is to figure out why. In other words, one of my jobs is to make you better and fix it. The other job is to figure out why the heck you got in to the shape you're in the first place. Do you have a crooked nose? Do you have an underlying allergy that's not been diagnosed or looked into well enough? Those two things really are what tell me what to do for you. And so if we look and treat with lots of saline nose spray, decongestants, drugs that make mucus thinner, 9 times out of 10 I can make you well. It's the other 1% or 10% that end up in the operating room. But it's those people who have exhausted conservative therapy, medical therapy.
We're learning today from Dr. Bill Parker. He is from Parker Sinus Center. You can find him online, parkersinuscenter.com. We've got a lot to learn today about the ear, the nose, and we even may learn a little bit about sound sleep today. I don't know, maybe.
Well, breathing has a lot to do with that, doesn't it?
It does. We'll be back more with Dr. Bill Parker, our life strategist today, here on Strategies for Living. Stay with us.
Just a drop of water.
Welcome back. Welcome back into 101.7 FM and 710 KEEL. Welcome back into Strategies for Living. We are marriage and family therapist Dave McMillan and PLPC Carla McCormick with Dr. Bill Parker from Parker Sinus Center today. And you'll find him online, parkersinuscenter.com. Lots of information. Great website. Lots of information on this site.
He's on Facebook, too.
Okay, there you go. You've seen a lot of changes. 1981, a few years ago, lot of changes.
In '81, David, we weren't even using scopes to do nasal surgery.
Wow.
I'll never forget going to Hopkins and learn in '82 or '3 how to use scopes in sinus surgery, and when I went with another active surgeon in private practice, and we came back and we couldn't get the rest of the community to buy into it. Joe Womack was his name, and he was a little more outspoken than I was. And then when we hooked
I'm
it
not
up,
going to touch that, by the
when
way.
we hooked it up to a camera,
Smart.
people were slow to buy into using a camera.
Right.
And then the navigation came along, and that was hard to sell, and it's not used by everybody here in town.
But it really gives you a preciseness that otherwise you don't get, right?
Well, the sinuses surround the eye. They lie up against the brain.
Right.
And
We're in precious territory.
there are
here.
reports in the literature of injuries to the eyeball
Right.
or the surrounding periorbita, we call it,
Right.
or the brain or spinal fluid leaks and all those things. And so the best way to make that safer is to have a computer assist the surgeon when he's in those tight areas, A, to be more precise, but B, to go in areas where he should, but also those areas where he should not.
Stay out of those areas.
You got to
shouldn't,
stay
yeah.
away from the areas that
First, do no harm, right?
that's what we all signed up for.
Yeah.
And so the current system is called the Fiagon system,
And you were very instrumental in its
well
origination.
Well, this one, my friend Eric Pearson and I kind of brought into Shreveport and finally convinced Christus Highland Medical Center to buy it for us. Not just me, for
Right.
any of the ear, nose, and throat specialists that operate at
Right.
Highland. And they graciously did, and it's a great addition to the ear, nose, and throat department and our ability to perform safe surgery in the area of the sinuses. And we are all eternally grateful for Christus Highland to do
investment.
that.
Now, not everybody's going to need surgery, of course. You do treatment, you do sinus treatment, and you have a unique approach. I know.
Some of the people will need nothing but good allergy control.
Right.
And if they are tested by our allergy department, and Steve Whited runs it,
Great guy.
a great guy, and if they do their job in avoiding what they're sensitive to,
Right.
and he does his job and I do my job, then they don't need an operation.
Right.
But it's those people who failed at conservative therapy,
Mm-hmm.
and that's what I say over and over and over again. If the drugs and all the conservative stuff you do doesn't work, then you need an operation.
Yep.
And by and large, the patient that ends up asleep in my operating room is that person.
Now, in the older days, when you did go to sinus surgery, you knew there was some recovery. How's it different now with the robotics and the technology?
Well,
How's the recovery different?
It's a whole lot more of a gentle operation.
Mm.
In most of my patients' case, everything is done through the nose. There are no cuts, and there's also no packing, no bruising,
Right.
no swelling. And so the operation should be and is in my OR just a whole different cat than it used to be. It's just a more gentle operation, more efficient in removing the disease, because you've got all the technology that Christus has provided us. And if you can be safer and be more efficient at removing the disease, then if you do it and you're gentle at doing it,
Right.
it's a great deal.
Absolutely.
If you have a white-collar job, for instance, you can have an operation on Friday and very realistically be back at a white-collar job on Tuesday or Wednesday of the next week.
Wow. Because I know it wasn't that way even the short time ago that you went into practice. It was not
There
that way.
used to be a lot of packing,
Right.
and that's just not necessary.
Wow.
So tell them, and nowadays they actually use a balloon, and they go in and they open the sinuses up, and then stents that are filled with medication, right, instead of the packing. So it basically opens it up. How's that work?
What the balloon physiology does, Carla, is it's used to go through the normal opening, and I emphasize the normal opening into any particular sinus, be it the frontal, the forehead sinus, or into your cheek sinuses, the maxillary sinuses. You go through the normal opening, and you dilate that opening so that you're not tearing tissue or removing tissue. You're just dilating it, and if you do it appropriately, then it stays dilated. And because you're not removing tissue, it's just not as painful, and there's not as much bleeding. There's no packing that's necessary, and we can actually use the Figon navigation system with the Entellus balloon technology, so that we can actually use the navigation and guide that balloon into a particular sinus if the anatomy is such that we can't find the right opening.
Mm-hmm.
And then use the balloon and the Figon system, and it'd be incredibly gentle. Well, before, you just had to plow your way through it.
Right. That doesn't sound good to me when you're messing with my head.
It sounds hurty.
Yeah.
But the balloon technology is just one more thing that's come around in the recent history of ENT that most of us have embraced.
And then the stents just hold it open. What do the stents do?
The balloon stents it open. The balloon doesn't stay. Nothing stays.
Right.
All you're doing with the balloon is opening it up. And because you're doing it through the natural opening, it'll stay open.
Stay, because that's what it was made to do. It was designed to do.
That's what it's designed to do.
We were talking. Carla was talking. You and Carla were talking earlier about the bows in your hair. So you do pediatric ENT. How young do you work with, Dr. Bill?
As little as they come. I mean, sometimes it's neonates.
Wow.
Sometimes it's 1, 2, 6 months.
So
It doesn't matter.
from young to old.
If they need me, they get me.
There you are. Okay. Are we taking as many tonsils out as we used to?
No, the tonsillectomies done in the 50s and the 60s were based on what we know now is flawed data.
Right.
And the thinking was, at the time, what was the accepted way to do things. But as we now know, the indications are far more strict than what they used to be.
Is there a point of sickness of the tonsils where they just have to come out?
There are two reasons to take out tonsils this day and time. One is for recurrent strep infections, which is, strep throat. And the other is for airway obstruction. And that's a recent, and I say recent, in the last 20 years, reason to take out tonsils. And we're so breathing oriented now, and children with huge tonsils and adenoids snored terribly, and there were missed cases of sleep apnea with huge tonsils. So we take them out like we used to for strep,
Right.
but not to cure every respiratory tract that the pediatricians thought that we might be getting because of nasty tonsils and adenoids.
Well, you bring sleep apnea up, and how big of an issue is does apnea cause? I mean, we've talked on this program so many times already about the importance of a good night's sleep.
Physical health, mental
Mental,
health.
yeah, and how big of a problem, Dr. Bill, are how many of us are running around out here with sleep apnea and we don't have any idea where we.
There's a bunch.
Yeah.
And the lay public knows far more now than they used to about the dangers of sleep apnea and the importance of sleep, and you guys know how important it is. But
From a mental, emotional point of view, sure.
Sure it is. Sure it is. Sleep is integral to every part of your life. But we see the people who and kids whose parents bring them in because they're snoring and they're tearing up the bed, and or even they're wetting the bed.
Right.
And you take out that child's tonsils and they're tons better. And in adults, there lies this graft of people, and on one end you've got the person who snores really bad and has a social problem.
Right.
On the other end of this spectrum, this graph, so to speak, you got somebody who snores so badly that they have a medical problem. They quit breathing.
Right.
And nobody knows where they fall in this spectrum until you get an exam by an ear, nose, and throat specialist who can tell you why you're having obstructed breathing.
And if it's at that end of the spectrum where it's a true medical problem, you're stopping breathing. You're risking death, right?
Doing nothing is not an option.
Right. Right. And the longer I go untreated, the longer that is untreated, there are cascading body complications that can open up. Right.
Well, if you think about it, David, if you quit breathing, say 6 times an hour,
Right.
and you multiply that by 8 hours of sleep,
Right.
times 7 days a week,
Right.
times 52,
Right.
that's a lot of times that your brain is sensing that you're not getting the oxygen, and it's telling your heart to beat stronger, beat faster. And so this is all something that occurs night after night after night.
Hence the heart problems that we learned about.
Hence, yeah. And so, all right, if you have questions beyond, if you want to continue, and I hope you will, the conversation that we're starting today with Dr. Bill Parker, how you do that, parkersinuscenter.com. And you can go see him, ear, nose, and throat specialist since 1981, Dr. William Parker, our life strategist today, here on Strategies for Living.
Lord, it's the same old tune, fiddle and guitar. Where do we take it from here?
Welcome back. Welcome back. 1017 FM and 710 KEEL. Welcome back into Strategies for Living. PLPC Carla McCormick, marriage and family therapist David McMillan, our life strategist this evening, Dr. Bill Parker from Parker Sinus Center. You can find him online, parkersinuscenter.com. You can find him at the Highland Clinic if he's not over at Christus operating, and he is that often and busy. And if I got to have one, I want him. Can I say more than that?
Nope.
Nope.
So Dr. Parker had a so in the interest of full disclosure, I did work with Dr. Parker at Highland Clinic amongst all the other doctors, but I will tell you that he's my favorite. Let's don't tell the others. But he had a patient who had sinus surgery, and she described the way she could breathe as before the surgery, it was like breathing through one of those little straws that you stir your coffee with.
Yeah, yeah.
And after the surgery, it was like breathing through like one of those big giant pixie stick straws, like those big plastic ones.
Wow.
And she said it was immediate. Like,
That's got to be fun for you, Dr. Bill.
It's way
got to
fun.
be fun. Wow.
It's way fun. I got a great job,
Yeah, you do.
and I take care of a lot of great people.
All right, let's get back to the sleep apnea because it's such a big deal. How do I know if I need you? How do I know if I need to go down this road because
well,
it
David,
is such a big
I would
problem?
think that your wife would tell you.
You snore.
The non-snoring bed partner generally says it's time to go see about your snoring.
Yeah.
And so generally the patient comes in, and oftentimes the non-snoring bed partner comes in, and we talk about exactly what the non-snoring bed partner, what they see, what they hear.
Yeah, sure.
And so then my job becomes, why do they have what they have? Why?
Right.
So people snore, but for one reason, and one reason alone, and that is obstruction to airflow.
Right.
That's it.
Right.
The obstruction can be at one or all of three levels: at the level of the nose,
Right.
at the level of the oral cavity,
Right.
and at the level where the tongue hooks into the throat.
Okay.
And so it's my job to look into all those places and identify what constricts the airflow, causes the tissue to collapse, and then explain that to the patient. And so whether or not a person has apnea is not determined by my physical exam. The areas that cause obstructed breathing are.
Right.
The way you find out if you got it or not is to have a sleep study.
And you can hook
And so
people
we
up,
order
send
the
people
sleep
to,
study.
yeah.
We use Well Necessities, and they've been doing my sleep studies for eons. Leah DeMarto, and so they have the patient come in. They hook them up to a very gentle system.
You spend the night there.
Spend the night. They leave you alone. They don't
Right.
bug you. They're not looking at you or preying on you all night.
Kind of like a hotel room. Nice
And
nice TV in there.
It
too.
is. It
Yeah.
is. It is similar to that. And then you get up and go to work the next day.
No hospital bed. They're comfortable beds.
And
Oh, you've been there, huh?
Yeah.
what they do is they get all their data and give it to a sleep specialist, and they look and they mark what they think is sleep apnea, and they send them the study to me. I get the patient back in, and we go, okay, you got it or you don't.
Right. Is the gold standard still the CPAP for a lot of people?
Treatment options are twofold. The easiest option is nasal CPAP. And
we should explain because not everybody's going to know what a CPAP
it's
is.
the mask that covers your nose, and the machine blows continuous pressure through the mask into your nose and keep the tissues from collapsing.
Right.
If they don't collapse, you don't snore, you don't have an apnea period. That all sounds very intrusive, but it in fact is not. The masks are gentle, the machine is small, and And
Doesn't make noise.
it makes very little noise,
Right.
if any. I mean, some of my best friends who have sleep apnea and whom I never thought would tolerate CPAP. I mean, we don't go hunting, but they don't take it with
they
them.
don't.
And for that, I'm thankful.
They can't sleep in the cabin without it, huh?
The other option, then, if you have trouble with CPAP, is a surgical one.
Right.
And the difference is CPAP's 100% effective. And even though our specialty has good numbers and surgical results are effective, they're not 100%.
Right.
So the people I operate on for sleep apnea have failed at CPAP. And they can't tolerate it, or they're claustrophobic.
Right.
Or any one of those things.
Well, I will say, and I hope you'll either agree or disagree, but I think you have to have you've got to. It's a part of it is a mind thing. You have to, or, with the information that you're going to provide, and the education and information you're going to provide, then I've got to decide I'm going to do this.
Well, if you do it and you feel better, then it's a no-brainer, though, right?
And that's what happens.
That's it. The first
That's what
good
happens.
night's sleep.
And
could,
you'd be surprised that people come back and they'll say, I woke up the first night I wore the CPAP, and I felt so much better. All of the nonsense that I thought was going to be a problem became much, much less of a problem.
Right. Right.
And so for the people who just can't do it, then we fix what's obstructed.
Right.
Whether it's their nose, whether it's a crooked nose, or polyps in their nose, or chronic sinusitis, or big tonsils, short pharynx, all those types of things.
Right.
There are different surgical procedures that I can do that can change that, and hopefully our success will continue.
Summertime, summertime.
What are we talking about? Swimmer's ear?
Yeah, well, you said it.
I know. I said we had to talk about swimmer's
We got to
ear.
bring up the
because-
children.
Well, I have 4 grandchildren now, and so swimmer's ear is it's on the radar.
Bill, let's help her out. Does she look? She doesn't
If-
look old enough to have to be a grandma.
If
Manny.
What do
if
you
you
want?
push the cartilage in front of the ear and it hurts, and you've had kids that have been outside sweating, exposed to the water, then you might have swimmer's ear. So, the way we treat it is antibiotics and ear drops. The prudent thing for most parents that I tell them, most prudent thing to do, is at the end of a swimming day, mix half alcohol and half white vinegar, half and half, and fill the ears up. Let them stay for a minute. Kleenex in a finger, let it all come out. You've acidified the ear canal and you've dried it with the alcohol, and that cuts down on all the things that cause swimmer's ear.
Half alcohol, half vinegar,
Right, white vinegar.
white vinegar, as opposed to.
I don't know, red wine vinegar.
Okay.
I don't know.
then they smell like salad.
Well, they smell pretty bad one way or the other.
Yeah, but they feel better, right?
Oh, there's nothing worse than to have a 3-year-old that wakes up in the middle of the night crying because of an earache, and you're on vacation, and you've been swimming in the pool for the last 3 days.
Absolutely.
It will ruin a vacation.
I got to tell you, folks, if you have any issues along the lines of your sinuses, the ear, the nose, the throat, Dr. Bill Parker is your guy. Parker Sinus Center is located at the Highland Clinic in Shreveport, and right next, adjoined to Christus Highland Medical Center, and again, he's one of my heroes in town. Has been for a long, long time, and so I hope you will. Continue the conversation that we've started today with Dr. Bill Parker. ParkerSinusCenter.com. We'll be back to wrap up here on Strategies. Stay with us.
Wishing I could see your face again.
Are we going deep into the sinuses here? Is this what
Going
you're
into the sinus zone.
going deep into the ear or into the sinuses? Oh, I like it. Creative work
kinda
there.
creepy to me.
Yeah. Welcome back into Strategies for a Living. 101.7 FM and 710 KEEL. PLPC. Carla McCormick, marriage and family therapist. David McMillan. Dr. Bill Parker. Oh, thank you. What a. You know, I know you are busy from early in the morning till you finish up every day. I can't tell you how much I appreciate, and Carla, I appreciate you coming and doing this, Dr. Bill.
Well, Carl, David, I mean, our job as physicians is the original physician was a teacher.
Absolutely.
And if I'm asked, or if we're asked as a discipline to provide some insight and education, then shame on us if we don't do it.
Right.
Plain and simple.
I love that attitude.
I do too. And you know, the thing is, and this is what I want people to know, and I hope they take away, and you know, it's scary when something's going on with us, especially with our breathing, you know, around our sinus areas, ears, nose, throat. It's scary.
Or when you can't get well and
Yeah.
you don't feel good, you know?
And so when you come to, you know, when you come to a guy like Dr. Bill that you know, again, people don't care how much you know until they know how much you care. So, you know, when you walk in and you know, you're what you've heard this evening is what you get in his office.
One of the things that I would love to leave with the listeners is that if you keep getting sick, ask your doctor the most important question.
Which
why?
is?
Yeah.
And if they can't answer the why question, then they need to see me or one of my colleagues here in town.
Right.
I mean, if you come back and you get drugs and you get better and you're on your third antibiotic and nose spray and decongestant and steroids and all this, and you don't ask your doctor, how come I keep getting sick, you may never get to see us
Right.
to find out the answer to the why
You
question.
might even ask your family doctor or your internal medicine doctor, is it time for me to go?
You know, why? Why
Yeah.
do I keep getting sick?
Yeah. Thank you so much for the work you do, and thank you for coming,
Oh, y'all are
being
great.
a great life
Y'all are
strategist.
great to
You got to
have
come.
me.
You got to come back.
I'll be happy to come back.
ParkerSinusCenter.com to continue the conversation with Dr. Bill Parker. And folks, thank you for tuning in to Strategies for Living. We've been brought to you by CADA, the Council on Alcoholism and Drug Abuse of Northwest Louisiana. Also by Milestones Counseling Center, by Jerry Anderson State Farm Insurance, by Learning RX, by Highland Place Rehab and Nursing Center, by Resilient House, and by Jacob's Well, inspirational books and gifts. If today were the last day of your life, you only had one more phone call to make, who would you call? What would you say? Why are you waiting? Make the call. For Dr. Bill Parker, for PLPC Carla McCormick, and for Reuben Wright, I'm marriage and family therapist David McMillan. See you next time on Strategies for Living.
This is 101.7 FM and 710 KEEL. KEEL, Shreveport.